Last week, I spoke with Dr. Sam Brondfield. He is Associate Professor of Clinical Medicine in the Department of Medicine, Division Oncology here at UCSF. Let's watch it. This segment is provided by Doritos Salon, San Francisco and San Rafael. And when I called you, I was just after listening to the radio station, and they have this new study based on data from 2023 that the numbers, the data they have was alarming for me to hear the increasing risks of colon cancer, especially on young people, age before 50 and under. And then what was alarming to me the most was the diet part of it, the processing food, the lack of fibers, and people who drink too much sodas. Is it too alarming for you?
This trend of increasing colorectal cancer in younger people is very alarming. And you're right that some of the risk factors for that have been around diet and exercise and consumption of processed foods, in particular processed foods and sugary sweetened drinks, and just the Western diet in general, which kind of prioritizes those things, processed foods and sugary foods and drinks. So it's unnerving to see that trend happening. The other big part of it has been a more sedentary lifestyle, people spending a lot of time sitting and not getting up and exercising and moving around. And those two things combined are probably contributing to this, increase in colorectal cancer in younger people.
That's scary. I mean, especially people who, work in the office all the time, sitting. And all the time I was thinking, obviously, I always thought on my not well sophisticated way to think about cancer. I never studied anything, but I always thought it was related to genetics too. And is it, right? But it's not the main trigger, or is still can you break it down?
Yes, yeah, genetics definitely contributes to cancer risk, and colorectal cancer in particular has a strong link with genetics. And a take-home message there is for anyone who has family members who have had colorectal cancer, or really cancers in general, it's really important to talk to your healthcare team about getting yourself checked out. So yes, genetics definitely contributes, but probably doesn't explain this more recent increase in colorectal cancer in younger people. And when we think of younger people getting cancer, we often think of genetics, but in this case, it seems much more likely to be environmental stuff, as we mentioned, about diet and sedentary lifestyle. There's other theories as well around like the bacteria in the gut changing and other exposures like microplastics. Nothing is for sure causing this that we know of in terms of one particular strong factor, but the leading theory is that it may be a combination of a lot of these things. I think the best advice, based on everything we know, is just to eat a healthy diet that's heavy in fruits and vegetables and fiber and light on sugar, light on very fatty things, just kind of keeping things lean, non-processed, low sugar. And then getting plenty of exercise. And those are probably the best things that people can do to try to keep their gut healthy in general.
And also, it's really expensive to have a healthy diet. In the last couple of weeks, I've been trying, my partner and I, we've been trying to go away from sugar. And I'm trying to find even chocolates without sugar.
Yeah, first of all, your first comment about affordability, it's no question really unfair and creates disparities around healthy food and healthy eating. People who have more resources are more readily able to afford healthy foods, and that's really sad. And I'll just say it's all about everything in moderation too. Like, we have to acknowledge the reality that we have a lot of these more affordable processed foods, and to tell people you can't have any of this stuff is not always realistic. So just do whatever you can, I would say, to eat as healthy a diet as possible.
That's a good advice. What about when it comes to exercises?
Yeah.
Would that help to prevent colon cancer?
Yes, we do see an association between people who are not exercising and a higher risk of colon cancer. So, exercising more and trying to meet the recommended threshold of exercising 30 minutes a day, 150 minutes a week if possible, is a great way to do what you can to try to prevent colon and other cancers.
Wow, that's, there's another side of me thinking like, okay, we cannot eat anything then anymore.
Yeah.
Isn't it weird? Like,
I
I mean,
know.
no sodas, no sugar,
Yeah.
and then if you depends on the type of a diet you are, if you're working out like crazy, you don't eat carbs a lot. What are you gonna eat?
And just to throw in on top of that, you probably are aware of previous work showing that any amount of alcohol is also not recommended. So it's tough. I mean, you're right. Like there's recommendations saying don't do this, 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 and we do have to couple that with the reality of what we have in our lives and societies around food and drinks. So I think my best advice is, again, just to do whatever you can to eat as healthy a diet as possible, as often as possible, to exercise as much as feasible, and to drink as little alcohol as possible, and to not smoke as much as feasible. I try as much as I can to adhere to all of those. And yet I occasionally eat processed food. I occasionally have, desserts with a lot of sugar. And, you also have to live and live as happy a life as possible. So every individual has to decide for themselves what level of risk is tolerable for them. And, it's true that there are many people out there who lead pretty unhealthy lives who don't get colon cancer. So I can't say, like, if you lead an unhealthy life, you will get cancer. That's not the case. But on average, folks who reduce their risk by living a healthy lifestyle are less likely to get cancer. Red meat in general is associated with the increased cancer risk, including colorectal cancers. So in general, the less red meat, the better. But I wouldn't say never eat red meat if you like red meat. I have an occasional steak and I love it. But I eat more chicken, more fish, vegetables, rice. That's a lot of my diet.
Oh, that's interesting. Yeah, the red meat, it's not news, but sometimes it's really hard to go away from it.
Yeah. And again, I don't think most people would say never eat red meat. I think it's important to try to not eat a ton of it if possible.
So you said you're seeing more people, even in their early 20s, with colorectal cancer. Why the health system doesn't check as early as 20?
Yeah, that's such a good question. So in general, the way that kind of our society and medical groups decide what recommendations to make around when to check for cancer is based on the ages at which it tends to really start to occur. So yes, it's becoming more common in young people, including in their 30s and 20s, but it's still relatively rare, to the point where if we recommended colonoscopies, for example, for all 20-year-olds, that would probably just not be worth it on a kind of grand scale.
Will break the system.
Yeah, the system financially probably wouldn't be able to support that. The age for testing for colon cancer has decreased. It used to be recommended at 50 to test for colon cancer, and now that age has dropped to 45. And I won't be surprised if it drops further to 40 in the future, just based on this trend that we're seeing.
When it comes to gay men, when it has penetration, for the bottom side of that relationship, is that more risk of that person getting colorectal cancer?
Good question. Receptive anal sex is not a risk factor for colorectal cancer. It is a risk factor for anal cancer because in particular, it puts people at risk for contracting high-risk strains of the HPV virus, human papilloma virus, and that virus puts people at risk for anal cancer, but not for colorectal cancer. So two very different cancer-related scenarios. Gay men, but particularly people living with HIV, should talk to their doctors about getting anal pap smears to check for anal cancer. So just another way to try to prevent and catch cancer early.
Is that the HPV?
That's the HPV-related one, the HPV-related cancer. Again, this is very different from the colorectal cancer that we're talking about, which is not related to that.
But not necessarily someone who has the HPV virus will get cancer.
Right. Most people, first of all, HPV virus is everywhere. Many people have the HPV virus. Not most people don't have the high-risk strains of it that lead to anal cancer, but even most people who have the high-risk strains don't get anal cancer. It's only a small number who do, but it's still important, especially people living with HIV, because they're at higher risk for anal cancer in particular, to talk to their doctors about getting checked out. Colonoscopy is considered by many to be the best test for colorectal cancer. I actually just had my first one, and it was not as bad as I expected it to be. But there are other ways too. Many people do the stool-based tests where they just smear some stool on a card and don't have to get the colonoscopy. There are other ways to do it, including kind of a smaller endoscopy, CT scan. So there's multiple ways to do it now that are effective, and some quite effective. The catch is, if one of those is positive, the colonoscopy is still recommended after that. But my take home is, please don't let the testing scare you away from getting checked out, because colorectal cancer is among the top 3 most common cancers now, among the top 3 most deadly, the most common cause of cancer-related death in especially young men, but second most common in young women. So really important cancer to get checked out for, because many people out there, if it gets caught early, it can even be prevented by removing a precancerous polyp, or treated when it's still at early stage before it gets to be incurable. So please get checked out. I also wanted to say there have been a few high-profile celebrity cases recently of colorectal cancer, and it's so sad when anybody gets that disease. But I hope a message from those cases in particular is that this can happen to anyone, and please do get yourself checked out.
Okay, thank you so much, Sam.
Thank you.
Yeah, see you next time.
All right, see you next time.